Earlier this year, we told you about a new type of healthcare clinic called the Good Clinic that has opened its first nationwide clinics here in the Twin Cities. Here is nurse practitioner Kim Young to tell us all about it and what makes this clinic so different than others.
What is the Good Clinic all about for people who aren't familiar with it? What makes it different than your typical clinic?
Sure. So the Good Clinic is primary care. So we are defined by our care as given by nurse practitioners. So nurse practitioner delivered primary care. So we do anything and everything you can think of primary care in addition to wellness planning. The foundation of all of our care here is developing a relationship with the patient where they really guide their care. They empower it. They are the driver. We give them the tools to make them the healthiest that they can be. It's founded in wellness. We offer wellness planning visits and would love for every one of our patients to have their own wellness plan that lives and breathes with them throughout their changes of their life to help them be their healthiest self.
What are some of those tools that you use at the clinic that you help with the client develop their wellness plan and things? And how does that different than like when I go see a primary care doctor at the clinic that I might be currently going to?
Absolutely. So one of the things, as you can see behind me, is we offer supplements here and essential oils. So we offer and some over-the-counter medication too. So we do offer kind of a East meets West mentality. So that wellness holistic focus. The wellness planning visit that we offer really revolves around the tools that it takes to have a person meet the four pillars, if you will, of good health. So activity level, we're screening folks. What's your activity level? How can we help you there? What's your stress like? How can we help you there? How's your nutrition? Do we need to work on balancing maybe your macronutrients or work with you with diet or something like that? How are you sleeping? All of those quality of life type of things, because all of those things are really important to, even if a person is well without medical diagnoses, or if they have medical diagnoses and they need, to really focus on the lifestyle. Some people that are so hyper focused on a medical diagnosis might not really be thinking about their diet or how they're sleeping. They're just hyper focused maybe on their medication. This opens the door to look at all things lifestyle for them, and we look at the whole patient as far as what's their ability to have good sleep, what kind of access do they have to nutrition and those type of things.
What kind of a role does your nutrition play into your sleep habits and things like that? I know I sleep well, but my husband, he could use some help for sure.
So much. So sleep is the foundation. I mean, if you're not sleeping well, really nothing else is going to work as well as it should, excuse me, in your body. So nutrition plays a really big role. So we work with patients on educating them on, first of all, what the heck is a macronutrient and a micronutrient and why do I need them? So, just like your car runs better when you put the right kind of gas in and you're keeping the good oil in and the oil changes and those things and keeping it running, it's the same thing with your body. So what you put in your body affects everything, including how you sleep. So really just looking at what a person's intake is. Are they way off balance with their nutrients? Do we need to bring that into a balance? And then what's their stress level like? So really all those things work together: stress level, what they're eating, are they drinking water, are they drinking pop all day? So many factors. Even including, are they deficient on certain nutrients? For example, magnesium is a nutrient that a lot of folks are a little bit deficient on. It's a micro deficiency. So they could take a lab test and it's going to not really show much. But when we supplement them with a little bit of magnesium at night before sleep, they end up sleeping better. They end up having less cramps. They end up, if they're kind of a muscle crampy type person, it's actually something that is for patients that have, chronic migraines, to take magnesium at night as a routine before bed. It's just a nutrient, but we can't get it as easily from our diet as some other nutrients. So I hope that kind of helps paint the picture there.
Yeah, absolutely. So if someone wants to get more information or maybe make an appointment, how do they go about doing that? And just a little bit about where are you located as far as the Good Clinic?
Yeah, sure. So we are located at 307 First Avenue Northeast in Minneapolis in the Nordhaus building right now. And so we have other locations coming up. We'll be in Eden Prairie soon, hopefully by the end of the summer at the Elevate building complex. And then we're looking at also opening in St. Louis Park either later this summer or early this fall. So we have a few locations. The easiest way to find us is thegoodclinic.com. And that's our website. So we really like folks to visit our website because they can learn so much about us, including get the phone number to schedule an appointment. Once we get you in for the first time, you get access to our portal where our patients can schedule online. They can have telehealth visits. They can have phone visits, really flexible to meet the patient where they're at. We know people have very busy lives, and we want to meet them where they're at.
Well, Kim, it's been a pleasure to have you on Inside Healthcare. Thank you.
Thanks.